Welcome back. For our example project, there were relatively few people who had relevant information. This meant that we had to be very targeted in who we invited to interview. Identifying specific people to interview can sometimes be difficult, especially if their positions or their contact information isn't publicly available. Identifying specific people to interview can also sometimes raise questions about bias. In this video, I'm going to discuss how we identified specific people to interview for our research project. Your topic may directly impact people on your research team, or you may invite stakeholders or community members to be involved in the design of the project to ensure that it's relevant. Our research team included several healthcare providers who work with diabetes patients. These team members both knew and worked with people who could be participants. Some research team members could themselves qualify as participants if we chose to include them. The question is, should you ever interview team members as a part of a project? There are often reasons for and against various design choices. The first principle is to be transparent about what you choose to do and why you chose to do it. Some of the reasons for including a team member as a participant include that they are knowledgeable about the topic, motivated to participate, easy to contact, and in a lot of cases, they may even expect to be interviewed. But there's reasons also for not including a team member as a participant. These reasons include the perception that their interviews will be given more influence, that they're involved in the research design choices for the study, or that their participation may influence the analysis of interviews. We decided to invite participants on our research team to be interviewed. We did, however, exclude these team members who were interviewed from participating directly in the data analysis. So why did we do that? Our reasons for interviewing team members included that there was a small number of potential participants, which would have been smaller if we excluded team members. They were knowledgeable and had a unique perspective on the topic and how the process of transition occurred. The team members who were interviewed accepted being excluded from the data analysis, and perhaps most importantly, we never thought their involvement would be perceived as unfairly biasing our results. Team members provided the names of other providers who likely knew about the topic. They also provided contact information, either email or phone, for some of these participants. This contact information was valuable because it was often not available through any other means. You can use published materials, internet searches, online forums or discussion groups, or even social media sites to identify specific participants to interview. We did not use this strategy in our example project because there was little written material identifying specific people involved in the transition processes we were focused on. We asked the people we interviewed to suggest any additional people who may have relevant information for our project. We would then invite these suggested people to be interviewed. This strategy of having interviewees identify other potential interviewees is sometimes called snowball sampling. In another part of the study, we wanted to engage young adults who had completed their transition into adult care. A pediatric diabetes clinic helped us identify these young adults. The clinic staff identified people who met our criteria by looking through their administrative records. Patients were then sent an information package about the study from the clinic so that their private contact information was not directly shared with our research team. Accessing participants through an administrative database often requires institutional approval and may be subject to increased privacy constraints. It is, however, a good way to identify specific participants based on their experience or interactions with an institution. Many topics have related community organizations, support groups, or associations in the community. You can contact these organizations to see if they will help advertise or recruit for your study. We did not use this approach for our example study. I have, however, used this approach with other projects with varying levels of success. Another approach is to advertise your study and let potential participants identify themselves. Advertising may be targeted. For example, recruitment posters placed where participants are likely to be, or to be a more general appeal. Again, I've used this approach for other projects with varying levels of success. We didn't use this approach in the example project because of the targeted participants we wanted to engage. To review, some of the approaches you can use to identify specific people to interview include research team members themselves, people known to the research team, people identified from printed materials or social media, snowballing, identifying people using administrative records, accessing people through community groups or associations, and advertising. Before moving on, it's worthwhile reviewing the participant plan we've developed so far. This includes the research questions you have, how we defined our initial study population, for example, healthcare providers involved in the transition, and then the specific people we identified within that study population. Some things to consider are, do the parts of the plan fit together well? Can the people you selected address your research questions? Are there other people who should be engaged, given your research questions and how you've defined your study population? Do you expect any issues contacting people? You can also review your plan in terms of its representativeness. If you want to make claims about a population, your data should be representative of all that population. For example, if we invited only male patients to be interviewed, it would not be fair to say that our results apply to a larger population. You should think about the types of representativeness that are important for your project and review your participant plan from that perspective. A consideration for our project was that Newfoundland has 4 separately run healthcare organizations or health regions. We needed then to engage participants from each health region to capture any variation in the processes. Developing your research plan lets you think about how your choices fit together in advance of doing your study. You can adjust any part of the plan, for example, the research questions, how you define your initial patient population or your study population, or the specific people you aim to initially engage. As you develop your research plan further, additional adjustments may be required to further strengthen your overall approach. In the next video, I'll look at the unique role of sample size for qualitative studies. Thanks for watching, and I hope you continue on to the next